Today I'd like to talk about VAX-D, or vertebral axial decompression, a revolutionary non-surgical treatment for chronic low back pain and sciatica. Chronic back pain has become one of the most significant medical and socioeconomic problems facing medicine today. Standardizing the care of low back pain is critical. Treating a patient can be one of the most challenging and at times frustrating situations for a physician. In many patients, the acute symptoms resolve in 1 to 2 months. Those who fail at the primary care level are routinely referred to orthopedists or neurosurgeons, especially if there is an abnormal CT scan or MRI. Most patients are not ideal surgical candidates, and a rush to surgery in these cases can lead to failed back syndrome. The primary generators of low back pain and radicular symptoms are disc injury and degeneration. Understanding of the pathophysiology enables the administration of treatments that directly target the underlying sources of the pain. VAX-D therapy should be considered for patients with discogenic low back pain who haven't improved with non-operative care within the first 4 weeks. VAX-D is safe and effective without any of the risks associated with spinal injections, surgery, or anesthesia. VAX-D therapy is a medical protocol that combines daily decompression coupled with the use of prescribed drugs. All treatments must be supervised by a licensed healthcare practitioner. The VAX-D table applies precisely controlled tension along the linear axis of the spinal column to distract the vertebral bodies and posterior facets of the lumbar spine. The treatment is designed to unload or decompress the spine and thus relieve pressure on structures that may be causing back pain. Patients receive VAX-D once a day for an average of 20 to 25 treatments, 5 or 6 days per week. The total number of sessions needed varies depending upon the severity of the condition and upon the patient's response. The table and console are designed to be operator-friendly. Each treatment session is about 45 minutes in duration, comprised of a computer-programmed automated process. Should a patient wish to end the session at any time, they simply release the hand grips. This adds an important safety factor to the treatment that gives the patient control over the procedure. A chart recorder on the console desk prints a tracing of the parameters achieved during each treatment session. These become a permanent record for the patient's chart. Each patient should have a consultation and a physical examination by a physician. A current MRI will be needed to rule out contraindications. Patients find VAX-D to be comfortable and relaxing. VAX-D tends to increase the mobility of spinal structures and relaxes muscle guarding. It's very important that during the course of VAX-D treatment, patients refrain from all exercise, physical therapy, or any activities that will load the spine and increase intradiscal pressures. Each VAX-D session consists of 15 cycles of distraction alternating with relaxation. Each of these phases is controlled through a variable timer. The protocol calls for 60 seconds of distraction and 60 seconds of relaxation. The total treatment time will be about 45 minutes. Many patients experience a relief of their pain and other symptoms during the VAX-D treatment session itself. Others will report a reduction in symptoms several hours post-treatment. These are good prognostic indicators that VAX-D will be successful. Most patients will realize a reduction in their pain and symptoms within the first 10 sessions. Patients with pathology at multiple levels that have been long-standing may require more than the average 20 sessions. Once the patient is in remission and has completed the treatment, it is recommended that they receive 1 treatment session per week for 4 weeks to reinforce the changes made and to monitor the patient's weekly activities. There is no reason that patients cannot return to their normal active lifestyle. Patients are discouraged from returning to heavy-duty work with heavy lifting, as the potential for re-injury and relapse is high. Most patients can expect a long-term result with VAX-D and can return to light or moderate duty work. VAX-D therapy is a safe, effective, non-surgical treatment that offers new hope for the millions of people who suffer from low back pain every day.